Good evening and welcome all to Herts Essex Fertility Center Open Evening. This is our February 2023 Open Evening. My name is Mr. David Ogutu. I'm a consultant gynecologist and medical director here at Herts Essex. With me this evening is Mana Marks. Mana is our marketing manager, and Jackie McAdam is one of our senior fertility nurses, so they will be assisting me with the question and answer session and also managing the program. This evening, we will provide a presentation about the clinic, the services we offer, as well as be able to answer some questions in the course of the presentation and also at the end of the presentation. At the end, we'll have a virtual tour of the clinic, and please feel free to post, to type out, use the Q&A tag on your Microsoft Teams in platform. Any questions or queries or anything that's not clear, and we will try as much as we can to answer most of them in the course of the presentation. But also at the end of the presentation, we should be able to answer all your queries. Any common theme queries, I will answer those live during the at the end of the presentation. Please keep your microphones unmuted and cameras off, and use your question and answer tags and to communicate with us in the course of the presentation. Your feedback is very important to us, not only in terms of optimizing the quality of our presentations as well as the services we offer, but also to ensure that we get as much information as we can from this presentation. So at the end of it, I would appreciate using a SurveyMonkey tag or link to give us a feedback. So a brief history of Herts Essex Fertility Center. We have been in operation since 1989. So this is one of the oldest, longest running clinics, IVF clinics in the country, if not in the world. Clinic was established as the Essex Fertility Center at Buckers Hill in 1989, and we then moved to this purpose-built IVF clinic in Cheshunt, Hertfordshire in 2007. So we're going to almost 20 years in this premises. Over 33 years experience in providing fertility services. More than 7,000 babies have been delivered in the course of the existence of the clinic through fertility treatments in the clinic. All procedures are performed under one roof. So we, unlike other clinics that have satellite services with stimulations in one part, or having to have surgical procedures in different parts, egg collection in different parts of the hospital. Everything is under one roof in one purpose-built, state-of-the-art clinic. The services we provide here include fertility assessment, so fertility tests to include male and female fertility tests to try and determine why the conception is not happening. We also perform fertility tests for those who are not trying to get pregnant, but trying to assess what their fertility status is, so to help them plan their fertility journey, whether to postpone having a baby because they're not ready. All tests are available, and results are issued available within the week of the test. We provide fertility treatments to include ovulation induction using clomiphene or letrozole for those women with polycystic ovarian syndrome, not ovulating, needing something to get them to ovulate. We provide intrauterine insemination, which is IUI, either using partner's sperm for heterosexual couples or donor sperm for same-sex or single women, or even heterosexual couples where necessary. IVF, ICSI, PICSI. We have an egg donation bank, so we've got an egg bank where donor eggs are available. We have a sperm bank for sperm donation. We offer genetic service, which is pre-implantation genetic testing, or PGT. We also provide genetic tests in pregnancy, as well as genetic tests for those who are looking to exclude genetic conditions that may run in the family. Gynecology screening and gynecology surgical services, pregnancy scans, early pregnancy care until 12 weeks into the pregnancy. We provide surrogacy service here. We are the largest surrogacy clinic in the country in terms of we've done the most cases of surrogacy in the UK. As I mentioned, we have an egg donation service, so we've got a donor egg bank as well as sperm bank. We also provide fertility preservation service, so for those looking to freeze their eggs because they're not ready for a baby or want to preserve them for future, freezing eggs in advance of cancer therapy or chemotherapy, freezing eggs for those who are looking to preserve the fertility before gender reassignment surgery, and also for the men looking to freeze their sperm before gender reassignment or before chemotherapy. That's all available in the clinic. Now, the main determinant of fertility is the age at which we have fertility treatments or try to conceive naturally. So the younger we are, the better our fertility potential. So in the clinic, we provide a one-stop fertility assessment service, which means for those who are looking to assess their fertility or having difficulties treatment, probably not at the point of starting fertility treatment yet, but having tests to assess what their fertility potential is or to determine the cause for their infertility. We realized in the past that the NHS or many other clinic screening and assessment processes were taking too long. So we had patients who were presenting to us at, say, 38, 39, 40, who had contacted their GP with difficulties conceiving in their early to mid 30s. But the process of test after test and appointments was taking so long. And by the time they come into us with a diagnosis to have fertility treatment, for many of them, it was getting quite late because their fertility potential had diminished with age. So we set up a fertility assessment service here, which means anyone who would like to know what the fertility potential is or having difficulties getting pregnant would be able to contact the clinic, and we'd be able to provide this test in a one-stop fashion, which means that within a couple of weeks, for most couples, would have an answer for them, which is that either hopefully everything is okay, continue trying naturally, something will happen naturally, or there's a problem, you need fertility treatment, or you have problems that need surgical intervention or medical intervention to treat the infertility or to optimize the fertility potential. So the different options we have include an egg reserve test, which is an antral follicle count, which is a detailed ultrasound scan looking at the ovaries to determine the reserve of eggs. We combine that with an AMH blood test. AMH is a hormone known as anti-Mullerian hormone. Women produce from their ovaries, and it's a good measure combined with the antral follicle count of the egg reserve. So it gives a very clear picture of egg reserve. We provide a 3D ultrasound scans, saline infusion sonogram to assess the cavity of the womb, Hycosi test to determine the patency of the fallopian tubes, a semen analysis, and we get the results almost all on the same day. For some tests where we have to do blood tests, it may take a couple of days or a couple of weeks to get some of the more complex tests, but usually within a week or so, we've got an answer, if not at the same sitting. Now, like I mentioned, main determinant of successful conception is the age at which we're trying to get pregnant. Slightly different between men and women. So for both men and women, our fertility potential declines as we get older, but it's especially significant in women. And that's because men continuously produce sperm into their 60s, 70s, 80s for some men. But with the eggs, women are special. They're born with a certain number of eggs, and they don't make new eggs going forward. So at birth, the average baby girl is born with about 2 million eggs. Half of those eggs are lost in childhood because we're not ovulating in childhood. When we get to 12, 13, 14, when women start to when most young girls start to ovulate, most of them have somewhere in the region of about 500,000 to 1 million eggs. And At the beginning of every cycle, a few eggs are normally woken up from each ovary. So if we look at the diagram on the top left hand of the screen, you can see an image of an ovary. And these round black dots, these represent potential eggs she's woken up. So young women tend to wake up lots of eggs. Naturally, only one of these eggs would develop to ovulation. The rest will normally go to waste. So female ovulation is a very wasteful process, using up several eggs every month. One ovulates, the rest goes to waste. The following month, the same thing will happen. And that will happen every month, gradually depleting the pool of eggs. And when you run out of eggs, that's when the menopause will kick in. So the younger we are, the more eggs we've got. The other more important aspect is the quality of the eggs. So if we look at a schematic view of an ovary with lots of eggs, and the bottom left-hand corner of the image, you can see that there are lots of green dots amongst the odd red dots. The green dots represent the genetically normal, good quality eggs. So when we're younger, we've got lots of these genetically normal, good quality eggs, and we tend to wake up our better quality eggs. So at a younger age, there's more eggs, but also each month, when you look at a bunch of eggs recruited, there's bound to be a higher proportion of good quality eggs in that bunch. But as time goes by, the number of eggs diminish. So in late 30s and 40s, a fewer eggs being recruited, ovaries are much smaller, but also the number of green dots are very sparse. So in a particular month, if you randomly recruit a number of eggs, the chances of that one green one appearing is much less than when we're younger. So getting help at the right time, getting the test in the right time, and where treatments or the decision to conceive naturally is made at a younger age, it's much more likely to work. And as time goes by, the potential diminishes. But the advantage we have with very good education in the world now is that lots of men and women are aware of this, and we're seeing the average age at which couples present to us, or single women present to us, to either freeze their egg, have treatment, or get tested is getting lower and lower, and we're seeing an increase in the number of successful conceptions through that. Following, other than the fertility assessments, we provide fertility treatments. That's on now?
Yes.
Yes. Apologies, for some reason my microphone went all mute. So I'm going to go back a little bit. So as we mentioned, the younger we are, when we start trying or getting tested, the better the chances of success. So for those looking to have treatment, usually within between 4 to 6 weeks, we'll be able to get them in for a formal consultation. And the first step of the formal consultation would be a pre-assessment visit with one of the nursing team. We get blood tests, including AMH, thyroid function test, for those who have not had one done before. We assess your general health, blood pressure, check weight and height. For those who are going to have treatment such as IVF treatment, our target BMI for us to safely sedate for egg collection is 34. Semen analysis can be produced either at home and brought in if the men live within an hour of the clinic, or it can be arranged to be done within the clinic. And we normally get the results of the sperm test usually within an hour or so of the production. Like with all industries and with work and things like that, during COVID-19, we moved to online consultations, and this has been very, very popular because it means that for most couples, you don't have to take a whole day off work driving all the way to the clinic. We find that online consultations have been very, very effective, but of course there is the option to have a face-to-face consultation for those who would prefer. But in most cases, the initial consultation is always online. It only takes about an hour, and then treatment is planned, and treatment can start from that point. The clinic uses an app known as a Salve app. So all patients who are going to have treatment with us will be provided with details to load the Salve app on. It's an excellent communication portal. It's got a medication manager on the Salve app, depending on whichever treatment you're going to be having. Instructions for the medication will be coming on the app. Clinic appointments will come on the app. It's got a secure messaging service, so if you need to communicate with the clinic, you don't necessarily need to pick the phone to call us. You can send a message, unless it's something very urgent. You can send a message, and the clinic will communicate through that. So it makes a big difference to how the process runs, and we're seeing very few missed medications or medication mistakes because the app reminds you of exactly when to take your medication, what dosage, and all of that. Now, fertility and fitness go hand in hand. So to not only optimize the chances of getting pregnant, but also improve the outcome of the pregnancy, minimize risk of problems in pregnancy, such as blood pressure problems, diabetes, then being in the right frame of right fitness and health status makes a big difference. So with initial consultation and pre-assessments, if there are any particular health issues that we need to optimize, then we will deal with those in advance. And we have a fitness for fertility program, so we'll have help from the clinic on how to optimize the fertility. We have communication and educational material, but also work with a dedicated specialist fertility nutritionist who will be able to provide expert help where required. Depending on the treatment required, if it is an HFEA or licensed treatment, which is IVF or IUI, then treatment information appointments are arranged, again, via Microsoft Teams. That's where all the necessary consent forms are signed. It's an opportunity to ask questions, where counseling is required. That's available for free through the clinic, and demonstration on how to administer the medication is provided on a one-to-one basis. There's some clinics that provide treatment information appointments in a group. In our clinic, we're very, very strict about patient confidentiality. So your treatment information appointment as an individual or as a couple would be one-to-one with a fertility nurse specialist. Prior to fertility treatments, we would always perform some assessments to ensure that there are no lesions or abnormalities that would affect the treatment or that would increase the risk of miscarriage. So for all our patients, where necessary, we would offer a 3D ultrasound scan to assess the nature of the womb, make sure there's no congenital problems like septums that may affect miscarriage rates. We also do something called a saline infusion sonogram for all, which is by getting a tiny bit of fluid in the cavity of the womb, we're able to assess the cavity in detail, make sure there are no polyps or fibroids or scar tissue there that may affect chances of conception or increase the risk of miscarriage. If there are, we resolve those before we start. For those who are going to have fertility treatments that require a patent fallopian tube, so those we're going to have things like clomiphene ovulation induction and timed sexual intercourse, or IUI, would always recommend that we check the tubes, because if the tubes are blocked, these treatments will not work. So we use something called a HICOSI, which is ultrasound based, to assess the tubes. We get the answers on the same day. There is some very good evidence that by checking the tubes, we not only confirm that the tubes are patent, but it's common that sometimes you got some mucousy plugs in the fallopian tubes that may be blocking the sperm or egg movement to meet. So by checking the tubes and flushing the tubes, we're seeing lots of pregnancies successful through IUI or even with natural conception. Should there be any problems such as fibroids, polyps, blocked tubes, then we have the surgical expertise within the clinic to deal with that. With most of our reproductive surgical procedures here would be through keyhole. So we have a hysteroscopy service in the clinic. So for those whose tests show that they've got a polyps or scar tissue or a septum, then within the clinic, we'll be able to get a telescope through the neck of the womb through keyhole and resolve that on the same day. There's no cuts involved. For those who need more complex work, such as endometriosis surgery or fibroid removal or problems with the fallopian tubes and blocking them, or for some cases where the tubes are irreversibly damaged, they need to be removed to optimize the success rate, then we arrange at the keyhole procedures at a local private hospital. Where open procedures like fibroid surgery is required, then that's provided as well. But of course, there's the option of referral back to your local NHS hospital or your nearest hospital for those procedures as well. All licensed treatments, which is IVF, ICSI, PICSI, and IUI, will require some screening tests. So the screening tests include HIV, hepatitis B and C tests, some chlamydia tests. Those have got to be done within 3 months of the first treatment. So in most cases, they will perform the tests at the clinic. But if you made arrangements at your local hospital or your local GP practice, so long as it's been done through a UCAS accredited laboratory and it's within 3 months, then we'll be able to accept those results. So the treatments include chromatin ovulation induction. Then the other treatment is, next step would be IUI. So IUI stands for intrauterine insemination. It's a procedure whereby we would time the woman's ovulation, and around the time of ovulation, inject healthiest possible sperm, which has been prepared in the laboratory, to be injected into the womb, and hope that the sperm will be able to swim through the womb into the fallopian tubes and meet up with the egg to fertilize the egg to then allow implantation. Now, IUI is not for all. It's only a small number of patients for whom it will be suitable. So for heterosexual couples who are able to have regular sexual intercourse at home, the IUI would not improve their chance of getting pregnant. The chance of IUI working is the same as the chance of them conceiving naturally anyway. So IUI would only aid those who are not exposed to sperm. And those who are not regularly exposed to sperm would include 1, heterosexual couples with psychosexual problems. So either the woman has got vaginismus, they're not able to have penetrative sexual intercourse, or not able to have it often enough, or for men who have difficulties maintaining ejaculation, to maintaining an erection to be able to have regular penetrative sexual intercourse, or for those who have severe premature ejaculation. So in those groups where they're not getting pregnant because the man is not able to deposit sperm into the vagina on a regular basis, then IUI would help. For single women who need donor sperm, or same-sex female couples who are using donor sperm, then the IUI is indicated. But for heterosexual couples having regular intercourse, IUI is not an indication at all. Egg freezing is another service we offer here, and we've seen a big increase in the number of egg freezing, not only in this clinic, but throughout the world. And this is not because it's become a fashionable trend. It is because the reproductive technology to preserve fertility has improved significantly. In the past, egg freezing was done using a technology called slow egg freezing, and the egg survival with this was not as good. Over the last 10 years or more, there's a new technology called vitrification, which ensures that the eggs survive much, much better. And there's very, very good data around the world now that whether eggs are used fresh or frozen, the chances of success are very, very similar. So very good successes with egg freezing. we're seeing lots of women who will want to preserve their fertility, either because they're still single or they may be in a relationship but not ready for a baby yet because of work or educational commitments, would freeze their eggs. So, for example, someone freezes their eggs at 30 and they have difficulties getting pregnant, say at 39, 40, 41. If they came back to use their 30-year-old eggs, whether they are 39 or 40 or 50, they will get the same chance of success as if they were 30. So that's the main preserve there. We also provide egg freezing services for women who are going to have chemotherapy for cancer treatments, so such as breast cancer or whatever, because chemotherapy or radiotherapy would affect their quality of their eggs. Many of them would be rendered menopausal by the chemotherapy. So by freezing the eggs in advance, they preserve their fertility. In the past, the law allowed women to freeze their eggs for up to 10 years. That law was changed in 2022. So from July 2022, anyone who has eggs frozen is able to store them for up to 55 years. So that's one of the reasons why we're seeing an increase as well. Surrogacy is the other treatment we offer. So surrogacy is where someone else agrees to carry a pregnancy for someone who needs a baby. So the surrogate would be the person carrying the baby, and the intending parent or parents would be those who wanted to have a baby but do not have a means of carrying a pregnancy. This could be two same-sex men or a single man who would like to have a baby but has no female partner to carry the pregnancy for her. They'll be able to use donor eggs, create embryos, which are the fertilized eggs, and get a third party to carry for them. It could be women who, for health reasons, are unable to carry a pregnancy because with their partner, either because they're born without a womb, they might have had a hysterectomy, or they may have medical conditions that mean a pregnancy is not safe. So they'll be able to get a third party to carry a pregnancy for them. And then the main other treatment would be IVF or ICSI. So again, the process with IVF would be a consultation, we come for the screening tests, information appointments, and then the stimulation starts. For IVF, for IUI patients who need donor sperm, on average from having a consultation to starting the treatment is usually a month or two, because they've got to source the donor sperm, get the hypoxia scans, make sure everything is in working order before they start. The rate limiting step is usually how quickly you can get the donor sperm. So we've got a sperm bank here. In most cases, we've got sperm for you to be able to use. But if you need to work with an outside sperm bank, it depends on how quickly you can get the sperm here. Once the sperm is available, is within the clinic, then they can be booked to start the treatment, usually within the next 4 or 5 weeks. But for those who are using their own sperm, or the sperm is already in here, then usually after information appointment, with the first period after that, treatment can start. Now, if we remember the image we had of the ovaries with several eggs walking up, only one would get to ovulate. With an IVF cycle, what we're looking to do is to get the eggs that would have naturally ovulated that month, as well as all the others that would have gone to waste, to all develop over a 2-week period. So you'd normally call on day 1 to say, period started, we need to start the IVF treatment. You'd come in, have a scan, usually within the first 3 days. And then on the 2nd or 3rd day of the cycle, we provide follicle-stimulating hormone injections, and you'll be shown how to administer these injections. Very, very fine injections. They go just underneath the skin on the abdomen. And over a 2-week period, stimulation will be taking place. During that 2-week period, you'll be taking the stimulation injections at home every evening, but you need to be coming into the clinic every 2 to 3 days to assess how the eggs are growing. Once the eggs are fully grown, you'll have a trigger injection called HCG to mature the eggs. And once the eggs are fully mature, then we plan to collect the eggs about 36 hours later. So we have an HCG trigger, which is timed exactly 36 hours before eggs are collected. On the day of the egg collection, you'll be admitted to the recovery bay. You have some baseline observations done. Then we get into theater. We provide anesthetic. It's called a deep sedation, so you're completely asleep, but it's not a general anesthetic. General anesthetic requires us to paralyze your breathing and get you to breathe through a tube. But with the egg collection, there's no cuts involved, so you don't need a general anesthetic. It's a deep sedation, which means you're completely asleep, but you've got an oxygen mask to ensure you've got enough oxygenation, and it works very, very well, and you recover very, very quickly after the egg collection. So sedation is provided in theater, and using an internal scan and an ultrasound, we can collect the eggs available on the right as well as the left side. The egg collection process does not exhaust your pool of eggs. We're only using what would have gone to waste that month anyway. Depending on the reason for the fertility treatment, the collected eggs will then be fertilized either using IVF, ICSI, or PICSI. IVF would be indicated in those cases where sperm is all 100% normal. So we'll mix the sperm with the eggs, put them together in a petri dish, and rely on the sperm to swim and fertilize the eggs. So the sperm has got to be 100% normal for IVF. Where there's some weakness with the sperm, either because of how fast the sperm is moving, the number of sperm, the proportion of abnormal forms, if there's any concerns about that, then if we did IVF, there's a risk that the eggs will not fertilize. So in those cases, we'd recommend ICSI, and ICSI means we will be under the microscope picking one normal sperm to inject into each egg. Now, ICSI would ensure that you get the same chance of success as if you had normal sperm with IVF. Part of our semen analysis or sperm test involves something called an HbA analysis, which is unique to this clinic in that we screen the sperm to a higher degree to ensure that those cases where there is poor sperm maturity, we provide the best possible selection for sperm. So an HbA analysis assesses what proportion of sperm is normal. Normal sperm parameters should have a maturity level of more than 65% mature forms. But if you got less than 65% mature sperm, we'll recommend a treatment called PICSI, which stands for physiological ICSI. So the sperm will be tested further on the day of the egg collection, and then we screen out the mature sperm so that only we screen out the immature sperm so that only mature sperm is injected into the eggs, and that's PICSI. So fertilization will be IVF, ICSI, or PICSI. This happens on the same day the eggs are collected. So whether we're using a partner sperm, which will have been produced fresh on that day, or frozen or donor sperm, or in some cases where the man's had a vasectomy, or he has no sperm in the ejaculate, and we need to surgically collect sperm from him, the sperm will be produced to be used for either IVF, ICSI, or PICSI. So day 0, fertilization takes place. The next morning, we will get a call from the lab to confirm fertilization has taken place. So that happens on day 1. So day 1, confirm fertilization has taken place. Depending on the number of fertilized eggs you've got, the laboratory will let the patient know which day they will be having the eggs, the embryos put back in. So on day 1, the eggs are fertilized. We'll then grow them in the lab over a 5-day period. We don't expect all the eggs to be able to produce a pregnancy. And so in that 5-day period, the eggs that had no chance of getting us pregnant will stop growing, or they'll have poorer growth or slower growth. But the ones with the best chance of producing a pregnancy will stand out as the best quality eggs to go back in on the 5th day. If we have 3 or more fertilized eggs, we leave them undisturbed in the incubator for the 5 days because we need time to help us to determine which is the best to go back in. If we've only got 1 or 2 fertilized eggs, then the decision is made earlier. We're going to be putting both back in. So in those scenarios, either on the 2nd or 3rd day, which is day 2 or day 3, you'll be coming in for the embryo transfer. But 7 to 8 out of 10 times, it's going to be day 5 transfer. What will be happening in the incubator is that from one egg cell fertilized by sperm, cell division will be taking place. So by day 3, we've got about 8 to 10 cells on day 5, and then by day 5, this fertilized egg has divided to the point where it's got about between 100 to 150 cells. And so this is called a blastocyst stage. This embryo will have lots of cells on the outside that will form the placenta or the afterbirth, and a bunch of cells within. It's called the inner cell mass. This is what's going to form the baby. So ideally, look to pick the best one to go back in. The younger we are, the better the chance of success, but also the higher the risk of multiple pregnancies. So for most women who are 40 years old or less, we'll be looking to only select one to go back in, especially if the quality is very good. Now, if the reason for that is if we put more than one and you fall pregnant at that younger age group, there's an almost a 50% chance that both of them implant. And if both of them implant, then they could result in a twin pregnancy, or occasionally one or both of them could go on to split, in which case we're dealing with a triplet or quadruplet pregnancy. Now, twins may sound like a good idea to some, but from many, many years of experience, almost all fertility clinics around the world have realized that for our patients, their best possible chance of taking home a live, healthy baby is if they're carrying one as opposed to two. So in almost all cases, we'll be recommending that only one goes back in, especially if the quality is good. If quality is poor or average, then we may put two back to maximize your chance, but in most cases, only one goes back. The reason for that is the female womb is engineered to carry one baby at a time. So with the one baby growing in the womb, it will stretch the womb, and normally by the time we get to about 30, 40 weeks, the womb is so stretched that you either break your waters or you go into labor, and baby is delivered usually at 38, 39, 40 weeks. And this baby is fully mature, has a much better chance of survival. If we crowd the womb with more than one embryo and both of them implant, and then some women may be unlucky that by around 23, 24, 25 weeks, their waters break or they go into labor. And if that happens, these babies are going to be too premature to survive, or should they survive, there's a significant risk they will survive with disabilities. So best scenario, best option to optimize chance of success is one to go back in, freeze the rest if they have good enough quality so that you get to carry these babies one at a time. Of course, as we get older, the risk of multiple pregnancies diminishes, but also the risk of implantation diminishes. So for those in 40 plus, then would say put two back in to maximize the chances, but in most cases, it will be one at a time. We also have a PGT service in the clinic, which means that for some who are looking to have a much more detailed assessment of these embryos on day 5, would be able to take some biopsies of the embryo to get a few cells from the embryo to assess their genetic composition and only put back the ones that are genetically normal, and that minimizes risk of miscarriage, but also optimizes the chances of implantation. But the PGT is the pre-implantation genetics testing is only for some select cases. It's not a routine procedure. Any spare good quality embryos will be frozen for future use. So up to 40% of our patients will have something spare to freeze. But unfortunately, 60 out of 100 cases, by the time we've selected the best one or two to go back in, whatever is left over will not be of good enough quality to freeze. We will only freeze good quality embryos because those are the ones that have got the chance of the capability to survive the freeze and thaw process to be able to produce a pregnancy. So on the day of embryo transfer, for embryo transfer, it's pretty similar to having a smear test. So we need a speculum. Once the embryologist has selected which embryo to go back in, speculum using ultrasound guidance will be able to place the embryo in the best possible position within the cavity of the womb. Normally takes at most 5 to 10 minutes. There are some patients who may not be able to tolerate the speculum or the embryo for the embryo transfer. So for those, we may give them some oral sedation, or some may require intravenous sedation. So we put them to sleep for the procedure. So women who've got vaginismus will not be able to tolerate it. So that's an option. But I'd say 99.9 out of 100 of our patients are able to tolerate the embryo transfer without the requirement for sedation. Embryo transfers here will be performed on the best date for your embryo and your womb. So we do embryo transfers 7 days a week. So if the embryos are ready for transfer on a Sunday, there's going to be someone in the clinic to transfer the embryos on a Sunday. So some clinics don't do embryo transfers on the weekend. In our case, we do embryo transfers 7 days of the week. You'll be given an opportunity to see your embryos before the transfer, and you take a picture with you as well. And during the transfer, you'll be able to see the embryos as they go in as well. We do offer embryo glue, which is a special culture medium, which mimics the conditions and the enzymes that the pregnancy, the womb should be producing to help with implantation, especially for those who've never had a positive pregnancy test before, and there's no test of determining who is producing enough of this enzyme to optimize implantation. We'd recommend embryo glue. For those who've had pregnancies before, that's a test that their bodies are producing these enzymes anyway. They may not benefit from it as such, so it is an option. So I'd mentioned pre-implantation genetic testing. So it is a service we offer at the clinic as well. We've got pre-implantation genetic testing for aneuploidy, which means we're testing to rule out the common chromosomal problems that will normally affect implantation or that are associated with miscarriages. So things apologies if my sound has gone off again. And so I'll go back again. So blastocyst stage will freeze, we'll recommend one to go back in and freeze surplus ones. We run a 7-day embryo transfer program. So whatever day your embryos are suitable for transfer is the date when embryos will be put back in. And we also provide a PGT service, pre-implantation genetic testing service. This is not for everyone. It will be for select cases. It is a process whereby we can test the embryos for genetic abnormalities before we put them back in to select which ones have got the best chance of getting through pregnancy. Or for some couples who have genetic problems such as sickle cell, cystic fibrosis, BRCA gene, Huntington's disease, would be able to screen out the affected embryos and only transfer those that are not affected. There are certain scenarios where there are structural rearrangements, where couples have had miscarriage after miscarriage, and genetic tests have shown that the miscarriages are because of a structural rearrangement. And that's we could also be able to screen so that embryos that have that structural rearrangement are screened out, and only the ones that are genetically normal are put back in. With PGTA, the embryos will have to be biopsied, screened, frozen. Because it takes up to 2 weeks to get the results. Once the results come back, it's going to be able to determine which ones are normal to be put back in. This clinic pioneered an IVF witness system. It's the first clinic in the world to use an IVF witness system. We worked with industry to develop it. It is a system whereby when you come for your egg collection, once eggs are collected, sperm is produced, they will be tagged with a special tag, and you go home with a card which has got a special electronic tag that will help us to identify will confirm for you that the sperm and the eggs and the embryos belong to you. So when you come in for the embryo transfer, it goes onto an electronic reader and it confirms that your electronically tagged embryos are the ones that are transferred to you. So we not only rely on the electronic witnessing system, at every step, 2 members of laboratory staff have got to confirm your identity and the identity of the sperm, eggs, and the embryos. But in addition to that, we've got an extra step, which is the IVF witness system. And we're proud in this clinic to confirm that there's never been any case of mix-up of eggs, sperm, or embryos, because we're not only using the industry recommended 2-step witnessing system, but we also have the IVF witness as well. Hopefully, a positive pregnancy test. In each case, we see you for your first pregnancy scan at about 7 weeks, when you're about 3 weeks after the positive pregnancy test, when you're about 7 weeks chronologically. And what we're hoping to see is a pregnancy that's implanted inside the cavity of the womb, a little yolk sac that's feeding the baby. And this is the inner cell mass having developed further into a fetal pole. This is what will become the baby, and there should be a strong heartbeat developing there. All being well, you'll be referred back to your local NHS hospital for your antenatal care. We do offer a second optional scan at about 10 weeks of the pregnancy, and this is an ultrasound scan at about 10 weeks. By 10 weeks, the baby is lots more developed. You can see the head, the limbs, a large umbilical cord, feet, fingers. There's lots of fetal movements, but most importantly, by this stage, the baby's placenta will be producing lots of the baby's DNA into mom's circulation. So for those who want to have a much more detailed screening test for things like Down syndrome, trisomy 13, 18, from a simple blood test from mom, would be able to isolate the baby's DNA and screen to a 99.99% certainty, which is a much more detailed screening test than you get on the NHS. This tests for up to 8 different chromosomal problems. It also screens for sex-linked chromosomal problems, so it will also be able to reveal the sex of the baby. For those who don't want to find out the sex of the baby, you can still do the test and the laboratory will not reveal the sex of the baby to you. But for those who want to find out, then by 11, 12 weeks into the pregnancy, you will know from the test whether this baby has got XX or XY chromosomes. And at that point, then you carry on with antenatal care at your local NHS hospital. We do have an NHS contract, so most of our patients here will be self-funded, but we do have an NHS contract with the Mid and South Essex region. So patients from Mid Essex, Castle Point and Rochford, Thurrock, Southend, there's NHS funding for them. So for those who are eligible for NHS funded treatment, who have been assessed at the local NHS hospital and their funding approved, then Herts Essex is one of the choices of clinics where they can have their NHS funded treatment. But the vast majority of our patients will be self-funding. So either funding provide with paying for each treatment as they go along, or using funding packages, or through other programs such as a sperm and egg share program. Egg share program is where for those women who have an above average reserve of eggs, so an AMH of more than 15, who are looking to have fertility treatment but would want to donate as well, they'll be able to have the treatment at no cost to them. They will provide, they'll be provided the screening test, the medication, the treatment for free. They will use half the eggs for their treatment, anonymously donate the other half of the eggs. We also have a freeze and share program for young women who would like to freeze their eggs. Some would also be able to use a freeze and share program, which is they would use it. They'd have the treatment at no cost to them, but and freeze half of the eggs for their future use and anonymously donate the other half of the eggs for those looking to use donor eggs. The clinic would never approach anyone to ask them to donate their eggs or the sperm. It's got to be the patient or the couple to approach the clinic to ask for more information. They'll have to have counseling, all the information provided for them. And then if on the basis of the information they've got, they decide that they would like to use the egg share or the freeze and share program, then that's an option for them. We also have a donor bank, a donor egg bank here. So we do see some women coming in to donate their eggs altruistically. Many of them are women who've egg shared before. They've had their family, but they're aware of the shortage of donor eggs in the world and the country in particular, and some would come in to donate their eggs to help out. The average cost of treatments would depend on the treatments you're having. So treatments such as IUI, cost of an IUI treatment program is about £1,150. For those who need donor sperm, then there's an additional cost for the donor sperm, which comes to about £1,000. For those heterosexual couples using the man's sperm, there's no cost for donor sperm. An IVF program here is about 3,800. ICSI is £5,000. Donor egg cycle, depending on medication, will come to between £10,000 to £12,000. All the costs for all the treatments that the clinic provides are available on our website. So you'll be able to go on the website and look at what treatment is applicable to you, and you should be able to get the cost, and there's a cost calculator as well. When you come for consultations, we'll of course have more detail of what treatment you need, and we'll be able to discuss all the treatment costs with you in detail before you commit to the treatment. Access Fertility is a finance company that sits outside of the clinic that works with clinics that have got high success rates to provide some funding options for patients. The way it works is these treatments are unfortunately a marathon rather than a sprint, which means for some lucky couples, the first cycle works for them, but for the other half, it may take 2, 3, 4 goes before they get there. So with Access Fertility, for example, the IVF Unlimited package works in the manner that you would pay a certain amount of money to Access Fertility. So prices start from around £9,000, and for that cost, you'd be able to have as many IVF ICSI cycles as you can fit in 2 years. But if at the end of the 2 years you're not successful, they will refund that money back to you. Now, for them, if it works for you with the first cycle, they make a profit. But if it's taking you 2, 3, 4 goes to be successful, then you benefit that way. But of course, we'll provide details. You as a couple will decide whether to use the packages or whether to pay for the treatment one at a time. There are no right and wrong answers. Emotional support is also provided. So we have a patient support group. You have counseling available for free. And this is for male, female, heterosexual couples, whatever treatment option or how you describe yourself. There's a different group for each of these. Like I mentioned before, we have a dedicated fertility dietitian who provides one-to-one consultations for those who require it, and the clinic will be able to provide details of that. We'll make an appointment with her and get a fertility program with her. Why us? We've been doing this for a very long time. We run the clinic to work for you, not for ourselves. We're pioneers at lots and lots of new technologies, to include electronic witness system, emotional support, and support through the treatment is available to the clinic. We're aware that it will not work first time, or unfortunately for some couples, it will not work with fertility treatments through the course of this journey. For most, it will, but some, unfortunately, it may not. But our main focus in the clinic is not only to make it work for you in the shortest possible period of time, but also to ensure that that journey and the experience is as less stress as possible. So we pay a lot of attention to supporting you. Most of the staff at this clinic have been here for a long time, and that's for a reason, which is that they enjoy their work here. We're a family, and our patients are part of our family here. And it's not only about providing a clinical service, but it's also being about providing a service to our fellow humans who unfortunately are going through difficulties with conceiving and trying to get them to the other side, get them into parents with as less stress as possible. So as I mentioned before, your feedback is very important to us. So hopefully at the end of all of this, I think Mana will send you some details to give us some feedback. Apologies again for the technical issues we've had with our speaker today. So at a few points here and there, we missed out on certain aspects of the consultation of the presentation. I think I hope I've gone back as far as I could to make sure we've not missed anything. But of course, during the Q&A, anything that's not clear, let us know, and we will clarify that for you. Please follow us on our social media pages. We are available on Facebook, Twitter, LinkedIn, and Instagram. And you got contacts for the clinic. So for those who, on the basis of this visit or in the course of the next few weeks, months, years, would want to contact us, give us a call back, and we'll be able to book an appointment for whatever service you're looking at, which is either new consultation, fertility assessment, that's all available. So we'll go on to the Q&A, but I'll in the meantime share the virtual presentation. Thank you for your time, and we will try and answer your questions as exhaustively as we can.